Tonight for you in Medical Rounds, recent CDC guidelines indicate that being overweight with a BMI between 25 and 30 puts people at risk for developing serious illnesses because of COVID. The risk increases as the BMI goes up. Joining us tonight is Dr. Pavlos Papasavas. He is the Department of Surgery co-director of bariatric surgery at Hartford Hospital. Doctor, thank you very much for joining us.
Thank you for having me.
Let me ask you, what does the CDC report indicate about the relationship between BMI and serious complications of COVID?
A recent study from New York showed that those who are overweight are twice as likely to require a breathing tube for the treatment of COVID-19 and 40% more likely to die of COVID-19 compared to those with a normal weight. And another study from the UK showed that those who are overweight are 40% more likely to require hospitalization for COVID-19. So the risk is real.
Real, and certainly sounds pretty scary when you read those numbers. You talk about those numbers right there. What is the definition of overweight? How many Americans actually fall into that category?
We use the body mass index, BMI, to measure obesity. So a person is categorized as overweight if the BMI is between 25 and 30. To put this into perspective, 70% of the U.S. population is either overweight or obese. So the majority have an abnormal BMI in the U.S.
What can be done to reduce the risk factors for folks?
Obesity is a chronic disease, and it's one that is very hard to treat. We have to start from something basic, making a healthy choice every time we choose a meal, increase our exercise. And there are other treatments that are very effective, including medications and surgery.
What are some of the available treatments right now at Hartford Healthcare? I'm sure there are some good options.
In Hartford Healthcare, we treat obesity in a holistic way with a team of talented people. We start from diets to exercise to behavioral modification to medications, endoscopic treatment, and bariatric surgery, which today is the most effective treatment for severe obesity and the medical problems associated with it.
Dr. Pavlos Papasavas, thank you very much for taking a few minutes to talk with us. We appreciate your time, sir.